Welcome back, family, to the Devine Inspired Care YouTube channel. Have you ever wondered about the early symptoms of colon cancer? This knowledge is not just fundamental, it can be a lifesaver. The initial signs may be subtle, but they are crucial to understanding this complex disease. The subtle changes in your body may seem harmless, but they can be manifestations of something more serious. If you are aware of these signs, it can lead to early detection. Early detection is pivotal as it drastically betters the chances of successful treatment. Today we're going to delve into this important topic, so let's jump right in. First on our list is constipation. Constipation could indicate various health problems, one of them being colon cancer. Studies have shown a correlation between constipation and an increased risk of this disease. The European Journal of Cancer published a study in 2004 that substantiated this correlation. They found a connection between constipation, the use of laxatives, and an elevated risk of colon cancer. The reason is that tumours in the colon can interfere with normal expulsion of waste from the body, resulting in constipation. Tumours in the colon can obstruct waste elimination, leading to constipation. Next, there's persistent diarrhea. In certain cases, prolonged diarrhea, persisting for a few weeks, may serve as an early warning signal. It's crucial to understand that this isn't just related to a stomach bug or poor dietary habits. In the realm of serious health concerns, tumours could be instigators of this issue. They may cause a confusing mix of symptoms, including both constipation and relentless diarrhea, which can make diagnosis difficult. Notably, these symptoms should not be overlooked or dismissed. If you're dealing with persistent diarrhea, it's essential to consult a doctor. The third symptom is blood in your stools. This seemingly innocuous symptom can indeed be a significant warning sign of underlying health issues. It's absolutely essential to understand that all types of bleeding are not the same. The source of the bleed can range from small ruptures in the blood vessels, commonly known as piles or hemorrhoids, to something potentially more serious such as colorectal cancer. Therefore, distinguishing the origins of the bleed is fundamental in the diagnostic process. Blood associated with cancer often has a dark red or black colour. It's of vital importance to not disregard such symptoms. Whether you're experiencing persistent or sporadic episodes, you should immediately consult a healthcare professional. Never ignore dark red or black blood in your stools. Always seek medical advice. A constant sensation of needing to have a bowel movement, even when there isn't stool to pass, is definitely a warning sign. This is not a symptom to be easily dismissed or ignored. It may seem embarrassing to discuss, but it's crucial to pay attention to what your body is communicating. This persistent nagging urge that never seems to be satisfied is usually not because of a mere digestive issue. It can often be indicative of something far more serious. Such symptoms frequently relate to tumour blockages in the colon, a condition that necessitates immediate medical attention. Narrow stools are another symptom to watch out for. This may not always be a cause for concern, but if you notice this regularly, it might be an indication of a larger issue. Stools are formed in the colon, and their shape and size can be affected by the condition of this part of your digestive system. Now, if your stools are persistently thin and narrow, it could be a sign of a blockage. The colon's natural space can be constricted by many factors, including the presence of a tumour. This abnormal growth can lead to changes in the look of your stools. It's crucial to be mindful of such changes and report them to your healthcare provider immediately. A blockage due to a tumour is a serious condition that requires prompt medical attention, hence be vigilant about changes in stool shape. Abdominal pain or a tender abdomen can be an early warning sign of tumour development within the body. This discomfort, often dismissed as a simple stomach ache, could potentially be a silent alarm signalling something more severe. This is especially true if the pain is prolonged or persistent, intensifying over time without any apparent reason or relief. It may vary in intensity, from a subtle ache to a sharp, stabbing sensation that disrupts daily activities. This pain can potentially indicate a blockage within the intestines or digestive tract, often a consequence of the growing tumour impeding normal bodily functions. It could also signify that the cancer, previously localized within one area, has now spread, metastasizing to other organs within the body. This spread is not confined to the digestive system. It could involve other vital organs such as the liver, lungs, or even the brain. Thus, such a pain should never be ignored or taken lightly. It's absolutely crucial to seek medical advice promptly if one experiences such symptoms. The sooner a potential problem is identified, the better the chances are for effective treatment and recovery. This pain can indicate a blockage or that the cancer has spread to other organs. Unexplained anemia, particularly iron deficiency anemia, is an intriguing condition that often finds connections with a severe disease like colon cancer. This type of anemia, characterized by a dearth of red blood cells in the body, can severely impact a person's health. It's a quiet predator that doesn't call attention to itself, but quietly erodes the body's strength. Medically, there's a strong correlation between this condition and the development of malignancies in the colon. The anemia frequently results from blood loss that can be traced back to tumours. These tumours, when present in the body, can lead to significant blood loss. This blood loss, in turn, contributes to the onset of anemia. It becomes a vicious cycle that continues to weaken the individual until it's identified and treated. So it's crucial for everyone to remain vigilant and watchful for any symptoms of anemia, particularly if they are unexplained and persistent. When an individual over 50 experiences sudden, unexplained weight loss, it can often be a worrisome sign. This unexpected change in body weight should not be overlooked or trivialized, as it is crucial to remember that our bodies communicate with us in various ways, including through such physical alterations. Weight loss, particularly when it is both abrupt and unexplained, can be an important signal that something is amiss within the body. Notably, this can be a red flag for colon cancer, a prevalent and potentially deadly disease. It's not something to take lightly or pass off as a result of dietary changes or aging. This significant symptom should serve as a prompt, an urgent call to action. When you notice this symptom, it's strongly advisable to consult a doctor. Early detection can often lead to better outcomes, and it's better to be safe than sorry. Persistent fatigue, which isn't related to physical exertion, can be a symptom of colon cancer. This fatigue isn't your everyday tiredness. It's a feeling of constant exhaustion that doesn't improve with rest, a type of lethargy that can interfere with your daily activities. The source of this fatigue is often linked to large polyps or tumours in the colon. These malignant growths can cause bleeding, leading to iron deficiency anemia, a condition which further exacerbates the fatigue. This fatigue can be linked to large polyps, tumours, and iron deficiency anemia. Finally, frequent gas and bloating, especially when accompanied by other symptoms, can indicate a tumour in the colon. These symptoms are often overlooked as common digestive discomforts. Many people experience gas and bloating on a regular basis, writing it off as a result of food consumption or stress, without considering the possibility of a more serious underlying issue. It's important to understand that while these symptoms might seem normal, if they are persisting and causing significant discomfort, they could be indicative of a more serious condition such as a tumour in the colon. It's crucial to listen to your body and take action if something seems off. Regular health checkups and timely medical consultations can help in early detection and effective treatment of such conditions. If these symptoms persist and cause discomfort, consulting a doctor is advised. In conclusion, the early symptoms of colon cancer can include constipation, persistent diarrhea, blood in your stools, and unexplained weight loss. Other signs may be persistent fatigue and frequent gas and bloating. Reducing your risk involves maintaining a healthy diet, regular exercise, and regular screenings. If you experience any symptoms, consult healthcare professionals. If this information was helpful, please like, share, and subscribe for more health-related content. Until next time, stay informed and stay healthy.